Fracture of talus bone. Anatomy of talus. Talus take part in weight transmission. 3/5 of the bone is covered by articular cartilage. Talus bone is the only bone have no muscle attachment. Blood supply of talus. It receives blood supply from 1. Anterior tibial artery, 2. Posterior tibial artery, 3. Peroneal artery. 60% of talus is covered by articular surface. It also receives vascular supply from anastomotic vessels from the surrounding capsule and ligament. The intraosseous vessels seen mainly from anterior to posterior. Fracture of talus. Occurs at head, neck, body, lateral process of talus. Mechanism of injury. Hyperdorsiflexion of foot on one leg. It may be associated with fracture of tarsal bone and fracture of metatarsal bone. Classification. Type 1. Type 2. Type 3. Type 4. Type 1. Undisplaced vertical fracture of talar neck. Type 2. Displaced fracture with subluxation or dislocation of subtalar joint. Type 3. Displaced fracture neck with dislocation of the body of talus from both ankle and subtalar joint. Type 4. Displaced fracture neck with dislocation of the body of the talus from subtalar ankle or talonavicular. Clinical features. 1. Patient presents with pain and swelling around the ankle. 2. On palpation, localized bony tenderness. Radiological features. Anterior, posterior, lateral and oblique views are needed. Management. Undisplaced fracture. Immobilization in a below knee plaster of Paris cast with foot in plantar flexion position.